Yeah, almost. It's almost 10.
Okay.
Mr. Clock says.
Mommy Heart with stars.
Hey, so for the public that's attending, you will need, if you want to speak during the call to the public, or if you are on the agenda as a speaker, you will need to click at the bottom of your screen. There's a participants button. When you click on that to see all the participants on the call, there's a raise hand function. You can click that button, and that'll notify Carlo that you wish to address the commission either during your called upon time or the call to the public, and he can unmute you so you can speak to the commission. I think we're ready, Mr. Fletcher.
Okay, let's do it. I hereby call to order this meeting of the Arizona Boxing and Mixed Martial Arts Commission. Today is July 9th, 2020, and the time is 10 a.m. Would those commissioners in attendance please identify themselves and identify whether they're here in person or via video conference?
This is Joe Pennington. I'm participating via Zoom, but on my phone, not actual photos. My camera's out.
Very good. And I am Scott Fletcher. I'm participating via Zoom. Welcome all. I hope you're all well and safe and continuing down the path. It's been an exciting few months and looks like there may be no let up. Let's dive into B, our new business. B1 is the financial update. It concerns the status of our commission finances. Mr. Meneses, will you speak to that, please?
Yes, sir. So we don't have the, so we just started fiscal year 21 as of July. And so we don't have the current finances for that yet. That is still being done with our CFO, Jason LaForest, and getting prepared for the governor's office. So what I do have is the previous finances so we can just kind of see where the commission is or was. At the beginning of fiscal year 20, which began in July of 2019, the commission had a sub-account budget of $101,181. At the end of the fiscal year, which ended June 30th of this year, the commission was down to $50,137. It is estimated that relatively soon the commission will be negative $51,000 in a matter of a very short time, just because of lack of events. That is the only financial information we have at this time. It is, we have to consider that when we do resume events, the budget issue is still not going to be 100% ironed out. One of the biggest ways that we get contributions to the sub-account is from a percentage of ticket sales that we assess the promoters 4% of their gross ticket sales. With doing a no fan-based event, we would not be able to raise that. For one major television event last year, it was approximately $50,000 from that one event. Looking at a forecast of a negative $51,000, we can see how that one major event could definitely change the outcome of our finances. It's just unfortunate that at this time we cannot continue with the fans due to the ongoing public health crisis. So we will have to try to find other means to recoup the loss.
Thank you. Commissioner, questions?
No, Mr. Chairman. I guess everyone is facing a very severe situation or challenge now, given this COVID-19 and not being able to have events. So I am not surprised, but I am, of course, concerned, as I'm sure everybody else is.
Agreed. You know, one thing that kind of came to the fore, we were talking with the UFC about a month ago about the possibility of them doing some of their events in town without an audience, and we realized that we would be doing it essentially for free if we did so. Many more things were involved in that, but without attendees, cash flow is really poor for us. I think those UFC events, Francisco, if I'm right, would have netted us $2,500. Isn't that right?
Yeah. So on the UFC, the event sanction fee for a larger promotion like UFC or Top Rank, one of those that have a recognized world title belt or on cable television, those are about $2,000. So aside from the official fees, which we don't touch at all, that go straight to the officials, the commission would only take in any licensing fees. We're talking maybe, $1,500, $1,200 on licensing fees, and then the additional $2,000 event fee. This is a good opportunity for us to work with our legislative liaison. One of the things that we've been pushing for the last 3 years since Carlo and I came on is making some modifications to our statutes in a way that we can actually receive revenue. And one of those possibilities is looking at tapping into a percentage of television sales, which many of the states that are very successful in having large events, one of the reasons is they have a larger account, and the account is generated from a percentage of television sales. So this is now giving us an opportunity to go back to the drawing board and try to see if that is something we can push for legislative changes early next year.
Mr. Meneses, do we have any idea if
become realized? My laptop is freezing up.
Yep. I hear you freezing a little bit. I see you freezing. Yeah, you're freezing a little bit.
Commissioner.
Yes, Mr. Chairman.
Mr. Fletcher, you might have to dial in by phone. Yeah, Mr. Pennington, I can hear you. I think it's Mr. Fletcher having some internet issues. We'll have to just hold off on business for a minute until he joins the call, since we lost our quorum. Right. So we'll just give him a minute, please, and then we can just resume.
The challenges of this technology are coming to fore.
I know. But I will say this is one of the fuller commission meetings we've had, so that's nice.
Yep.
I don't know if you're able to see on your screen or not, but looks like 24, 25 people attending the commission meeting.
Yep.
All right. I see his icon back on. Carlo, can you see if you can unmute him? Looks like I think it's the iPad name. Please. So we need some hold music or something. All right, there, he's back. We see ya. See, we're trying to get your mute off. Hold on. I think he's freezing again. Mr. Fletcher, if you can hear us, it might be better to call in on the telephone line that was sent in the email with this Zoom link, like Mr. Pennington did. And you may be able to reconnect and just listen audio. Looks like he jumped off, so hopefully he'll get that done. All right. Sorry about that. Mr. Fletcher was able to get the phone line. He is dialing in now. And as soon as he pops up, we will resume. There it goes. Mr. Fletcher, you back with
Hello.
us? There you
Hello.
go.
I'm so sorry about this. That's what you get for dragging old guys into a Zoom conference, you know?
Yeah, while you were gone, we talked about that. It's one of the challenges with this new format that we're doing. Right before your video froze, Mr. Pennington was going to ask me a question. Mr. Pennington, do you still remember what your question was?
Yes, Mr. Meneses, do you think the governor's office has an appetite for reviewing changes in legislation?
Yeah, so we've already been asked. We were just asked or just informed that it's they're allowing us to go back to the drawing board, not to go back to the drawing board, but to look at any rules for submitting any rule changes for the end of the year. So that was just announced this week. And so they're at least opening that door so we could start doing that at the end of this year. With any rule changes, there's a possibility of us tying those to statute changes, which would then open up the door for early January to submit those. So it'll all kind of tie into place, it sounds like.
Okay, thank you. I appreciate that. It's good news.
Yes.
Indeed, yeah, and we probably need to get out in front of that now that it's July, don't we?
Yeah. So Aiden and I have a meeting next week to start the Aiden, Max, and I have a meeting next week to start the process. And that requires us submitting our justification and what rules we'd like to change.
Okay, good. Well, more to come on that, but let's get out in front of it as best we can. Let's press on and talk about COVID-19, the COVID protocols. Mr. Meneses.
Yes, sir. So I'm going to do a screen share for those of you that have ability to see the screen. Carlo, can you fix that, please? Try it again. Okay, here we go. So this is the COVID protocols that I'm sharing. It should be coming up on your screen now. The commissioners, you should have already received this in advance over the last few weeks. We worked to develop this. This was a collaborative effort with our chief ringside physician, Dr. Ken Oda, who is on the call. We also met and talked with Dr. Don Musi, who is the president of the Association of Ringside Physicians. He was also one of the few doctors that worked the first UFC events in Florida when we returned back under the new COVID normal. So he was instrumental in helping identify issues or procedures that did or did not work. And then finally, we were able to attend the World Boxing Association's medical symposium to discuss COVID-19. Dr. Musi was part of the panel of doctors from all over the world. There were doctors from Europe and South America, United States, and other countries that were able to contribute their information as to what would constitute a safe event. So all those things together, we presented this document to you, to the commission. This document outlines what the commission expects for testing and to have a safe event so that we can try to resume some kind of normalcy and have sports, but to ensure that we are adhering to our number one job as regulators, and that is to ensure the health and safety of all participants. And so this document really does outline a great process to ensure that the events are safe and clean and sterile, as well as everyone is adequately tested. So you've had a chance to review this. I'm just going to kind of quickly go through. This outlines in the commission section that we require every promoter to submit a 10-point plan. The 10-point plan requires a promoter to notify us, the commission, how they plan to address the 10 things such as the recommended physical distancing guidelines and protection and prevention measures, and the testing and daily screening procedures, the isolation guidelines, positive test procedures, cleaning procedures, any staffing requirements, weigh-in and walkout procedures, locker room assignments and cleaning procedures, and post-event follow-up procedures. We wrote this out kind of thinking from start to finish, where is everyone going to be doing, touching, sharing, what do we need to ensure that is clean, sterile, and safe. And so we kind of just started going down the process, and this is what we come up with. We want to make sure that anyone coming from out of state, out of Arizona, submits a negative COVID-19 test, especially concerning during this time when Arizona has a surge in cases. We want to ensure that we are not contributing any further to the virus, as well as we don't want to bring someone who may potentially be infected with COVID-19 and get sick, and have them away from their family and their loved ones, in a different state, in a different place, trying to get care. So we will require them to get tested before they leave their state, and then once they arrive, to ensure they didn't pick up a new infection once they're here. Anyone in Arizona would be tested 72 hours in advance of the weigh-ins. One of the things that the commission may have to go back and visit on this at a future time is that we're already learning that the response on results are already varying in time. Originally, we were told by many labs 24 to 48 hours. So when we developed this document only a few weeks ago, we figured 72 hours would be a sufficient buffer if labs are returning in 24 to 48 hours to give promoters an extra little bit of a window to get those results done. We're now hearing a huge range. Mr. Lopez from Rough MMA did find a lab that was promising to still try to do a 48 to 72 hour turnaround. But amongst our colleagues in the combat sports world and in the medical community, from what I'm hearing, it's anywhere from 4 days to 2 weeks sometimes to get results. It just kind of depends who does it, where. It's all varying different information. So the commission may need to, as we get more information, as we're looking at this, may need to go back and just kind of modify some of these timelines or these guides. One thing that we'd want to ensure is that we limit how many people are in the building. So this would be only people that are essential for the health and safe regulation of the event, as well as limited staffing that are needed to either put on the production or to be present for the event. So that would limit it to 2 corners per athlete, including for any title fights. We would just keep it limited, and everybody would be required to wear a mask, except for the athletes during competition, but everybody else during the time, and making sure everything is clean. As you go through, this would require daily temperature checks of everyone that's going to be involved in the venue or be around any of us that are going to be at the event. It would also require the commission to medically suspend anyone that does test positive for COVID-19 so that they do not continue competing in other states or anything else, putting them in the national registry that they are COVID-19 positive, and until they can submit a medical clearance for that. The commission will ensure that we are adhering to all the CDC guidelines and pushing that information out as it becomes available, and it's all just public information that's pulled directly from the CDC website. This does put a lot of responsibility on the promoters to ensure that the testing is done and the PPE equipment is in place and the cleaning supplies. So this would be something that would need to be reviewed legally. What we've been informed of at this time is that the AG's office is unable to provide legal advice on COVID-19. Ms. Wagner may be able to, I don't know if anything's changed of that, but the last we spoke this week that at this time they were unable to review and provide legal advice on this document. So this is the document. We've already gone through it. It outlines what the commission responsibilities, the promoter responsibilities, and the cleaning and medical screenings. So it has been submitted to the commission for review, and if you commission approves of it, of adoption of the document.
Thank you, Mr. Meneses. I know you spent hundreds of hours on this, and I think it's I think it's a great document. The fact we can't run it through the Attorney General's office is disturbing to me. And gosh, the one sticking point for me is consistent turnaround on testing. I would hate to enter into an event and expect 72-hour turnaround and show up at weigh-ins with missing tests or tests starting to trickle in. Right now, as you said, there's very little reliability in their ability to get tests back out, and I sense that it may get worse before it gets better. That said, it's a great piece, and when people ask where we stand, I think this is a good document, but extending the 72 hours makes no sense. It just creates a time frame in which people can find themselves positive. So that's where I'm getting stuck, is on 72 hours. But otherwise, I think the document is excellent. It really gives our promoters an idea of what we expect of them and what we're going to try and do ourselves. Commissioner Pennington, thoughts?
Mr. Chairman, I agree that I think that it is a well put together protocol, very well documented. And I have a question about whether Ms. Wagner could help us here, whether we need to go through formal rulemaking to adopt this protocol, or whether we can adopt the protocol without formal rulemaking.
Well, there's always a concern when you're asking promoters to undertake further, basically regulation, that this could be construed as rulemaking. Obviously, I know that the chair had concerns about that it not being able to go through the AG's office. The recommendation is that any type of questions be focused back to the governor's office, since they're the primary office that is taking care of COVID-19 and how it's going forward.
So am I understanding that that's unclear at this point, whether we need formal rulemaking or whether we can adopt this?
It's not something that is going through as a rule right now. It's a protocol, but there is the concern that, a lot of these are additional requirements. So I guess I can't give you a clear-cut answer here, but it is, the statute does allow for the commission to regulate all activities concerning unarmed combat. And so this would absolutely fall within your purview. If it's a protocol, then obviously it's policy that the commission has dealt with before. But just be aware that there could be pushback on it.
And I haven't talked to Kelly about this, and I don't know if this is an option, but under the within the boxing statutes, where it references rulemaking, there is an opportunity to submit for emergency rulemaking. I don't know if this would apply, but it's to protect the health and safety of the industry in which you regulate. We could look at potentially submitting for an emergency rule change or implementation of this. Kelly and I haven't talked about that, but it was one of the solutions that we were asked to prepare and submit to the governor's office for review of ideas that we think that would possibly work to make this go forward. That was one of the ideas, as well as considering an enhanced liability waiver form. Those are currently under review, but we have not heard anything back, and that was all this week.
Thank you, Kelly. My thoughts are that if we are tasked with regulation and oversight, we have no choice but to publish some sort of document. These are different times, and we're obligated to test participants, amongst other things, and provide the safest venue we can. So doing nothing, I don't think, is an option, and I think this document gets us headed in the right direction, at the very least. Commissioner Pennington, what are your thoughts?
I guess I totally agree with you, Mr. Chairman, that we need to provide a safe environment for participants in the sport, as well as anybody there regulating or assisting in the activity. My concern is that without the ability at this point to have this thoroughly reviewed from a legal standpoint, that we may be doing something that is beyond really, I guess what I'm thinking is beyond really what the commission should be entertaining unless it has been thoroughly reviewed. I certainly would not hesitate to use this as a draft and certainly publish it as a draft, get input or whatever, as it shows here. But I'm just unclear as to how the commission should proceed without legal review on this.
Yeah, Mr. Pennington. Yeah, it's my my recommendation that if we are, and at no fault of our great AG, Ms. Wagner, if we're unable to get legal advice as to implementing this document and whether it's within our authority and so forth, it's really hard for us to implement this document at this time. I agree with you. We've made great progress, but I think there's still some policy and some legal questions that have to be considered and determined, and those are outside of our hands and Ms. Wagner's hands at this time.
Yeah, it's just certainly a very uncertain situation all the way around. I mean, it's new information comes out daily, and it's corrected the information from the prior day. So I'm sitting here confused and amused.
If I can touch on that real quick, when we developed this document, this COVID protocol with Dr. Oda and Dr. Muzi, one of the things that Dr. Muzi shared with me when he was helping provide some feedback was that his words were, the information that I provide to you today may be different from tomorrow and may change back to next week. This is a very fluid situation, and I express that to our promoters. We have to be very flexible while we're going through this. We're still determining what is the best path forward, what is right for the industry, what is right for us as regulators. This is going to be a fluid, ever-evolving situation as we learn new information. And so we just got to do the best we can, make do, and keep pushing forward as much as we can and trying to knock down every single one of these hurdles that we encounter.
Francisco Kelly mentioned going to the governor's office with this. How do you feel about that?
Yep. So we were already asked this week after I had the conversation with Ms. Wagner. We talked with the governor's office, and they had already asked for us to submit to them some outside the box recommendations on how we should proceed, and as well as how we think what would be best. So we submitted those. Like I said before, it includes the liability waiver, enhancing what we came up with last time, as well as looking at maybe doing some rule amendments or what's within our ability or purview.
Very good, thank you. Yeah, can you speak to what other states are doing as well, Mr. Meneses, regarding protocols and the like?
Sure. So not to toot our own horn, but I think we were one of the first states that actually had a COVID protocol documented. When I talked to Dr. Muzi after the Florida event, the Florida Commission hadn't come up with the COVID protocol. They just adopted what was submitted to them by the promotion. So we were one of the first states that jumped on this early on and tried to put this plan into place. Many other states are now looking at it as well, and many states are doing very similar plans. Dr. Muzi is now being tied up with other states and helping them develop their plans that are very similar to this. We've shared this document since we've already done the collaborative work together, and they're now using this to look at that information as well as their own health data and their own experts giving them information on how they're going to proceed. But essentially that's what the other commissions are doing is finding ways to put in protocols that require testing and sterilization and sanitation throughout the events, and isolation and contact tracing and all the things that are needed to do a safe event. And that's the way people are proceeding as of right now.
Thank you. Commissioner Pennington, where are you on this?
Mr. Chairman, first, let me thank Dr. Oda for all the work that he put in on this, and and everyone else, Dr. Mosey and everyone else that was involved in this. I really want to thank them. I guess, Mr. Chairman, where I'm coming from is until we can get this through the system and know that it is thoroughly approved, that we should continue working on it, but at this point should not take any further action on adopting it.
Very good. I tend to agree. It's unfortunate. We'd love some legal assistance when we can get it, because I think it's important to publish protocols. I think we're being pursued by promoters, I would imagine, and we're going to be asked how we like to go about business if we're going to, and we need to be able to answer that question too. So, Francisco, Dr. Oda, all of you, thank you so much for working on this. We're not done with this thing yet, and it's changing daily, but I think it's a great first stab at what we're trying to do.
Quick clarifying question. So if we're not doing anything with this, Ms. Wagner, since it's an agenda item on new business, do we need to make the motion on this and decide, or just keep moving forward?
Well, there probably should be a decision to either direct you as the executive director to continue to work with the governor's office, or to table the matter to come back at a later time, or to place it on the next agenda with direction as far as what's been learned from the governor's office.
So Mr. Chairman, I would recommend that that we definitely continue to work with the governor's office, and that we also table this for the next meeting and make this kind of a working document. As we continue to come back to meetings, we continue to see where we are in this process, and when we can implement it.
Sure, absolutely. Commissioner, would you attempt to craft a motion, if you would?
Certainly. Mr. Chairman, I move that we authorize or direct the executive director, Mr. Meneses, to continue to work with the governor's office and any other affected parties regarding the unarmed combat sports COVID-19 protocol, and to have it on all subsequent agendas until such time as we have this thoroughly worked out.
Thank you. I will second that motion. We have a motion and a second. All those in favor signify by saying aye.
Aye.
Aye. Motion carries unanimously 2-0. Pressing on, item 3 is our events under COVID protocol. The first piece being Commission Chief Ringside Physician, Dr. Ken Oda. Dr. Oda, are you with us?
He's going to get unmuted. So these three are kind of tied in together. I believe we do have Dr. Ken Oda here. I believe we have a representative from the Arizona Department of Health Services available. If you're calling via phone, oh, there you are. Yep, I see Rick Hazelton over here. Carlo, if you can unmute. And then Dr. Muzi from Association of Ringside Physicians was unable to make it. He was scheduled to also talk. I've asked him here to provide any questions that the commission may have, both Dr. Oda and the Arizona Department of Health Services, to try to hopefully answer any of those questions. I think the commission needs to consider a few additional things other than the COVID protocols when it comes to events. Dr. Oda and I have talked about some of the data the AZDHS puts on their website, which includes hospitalizations. One concern that I think that we need to keep in mind is that we are dealing with sports, combat sports, that have an inherent risk of injury and potential serious injury that require people to go to the hospital. As we watch the inpatient bed usage and ICU bed usage on the data rise, I think the commission may want to consider, in the event we do start moving forward once this comes underway, should the commission develop a certain threshold of looking at that data and determine that it's a best time to suspend events because the data is getting high? Is any of that of concern that the commission should be looking at? So commissioners, both these people are here to answer any questions that you may have when we're making these decisions.
Perfect. Thank you, Mr. Meneses. Gentlemen, thank you for joining us too.
Yes, thanks. And I apologize. I'm actually, here we are talking about COVID, and this is actually recovery day number 1 for me. I've been bedbound for the past 11 days.
Oh my gosh, I heard that. And doctor, I had heard that you had difficulty getting test results too. Am I correct?
It took me, a full week for my result to come back, and that was through Sonora
Wow.
Quest, and that should give you an idea of just how slammed the labs are now.
Mm-hmm.
And interestingly, I called Sonora Quest yesterday, and I talked to one of the representatives, and I tried to ask them if we did something where we were to do blitz testing for an event, would they be able to guarantee a 72-hour turnaround? And it seems like it's something that they'll have to go to bat to whoever the authorities may be to make something like that move. The guy made it sound like it's possible, but he didn't really sound all that sure either. So yeah, it's rough.
No doubt. Well, now you say this is day one of recovery. You're feeling better?
This is the first time I've been without Tylenol. My temperature's finally normal. I've been febrile for the past 11 days.
Well, thank God. We're glad to have you back on the mend. And thank you for all your efforts with all the various patients too. I'm glad you're feeling better. Yours is a cautionary tale. The fact that an important doctor in town can't get a response to a COVID test is alarming. Please give us your thoughts about all this, if you would.
Sure. In terms of events during this pandemic, or just in general?
Yeah. Well, that and our protocols, and yes, just staging events in this day and age, and I can see lots of problem areas, but I'd love to hear your perspective on it too.
Yeah, I think Francisco brings up a good point. So first of all, I think the protocol as it's set, it is sensible. I guess we got to figure out how we would get the testing back in time. That's a huge hurdle, but it's sensible. I think it works. I think the post-fight surveillance is going to be important as well. But the thing that actually seems to me to be quite pressing is the fact that our ICUs are starting to become saturated. And with how the governor has already shut down elective procedures in the past, it makes me wonder, are we headed in that direction again? And what would be the right threshold by which we would say, yeah, we cannot have an event with the inherent risks that are involved in mixed martial arts and boxing. If we have to start transferring people to the hospital, what kind of position does that put the acute care system in? Now, granted, I would say the majority of events that we've done, the rate at which we send fighters to the acute care system is pretty low. It's not that often, but with that said, there's always that possibility, right? We have events where we go in, nothing happens, it's a clean night, and then we have others where we've had to access EMS a few times. So it is a little concerning, but I don't know how to suggest what that threshold would be for the ICUs, for the hospitals, in terms of what would be an appropriate number to say, okay, this is green light, this is yellow light, this is red light. We can't do anything if we reach this number.
Right. Thank you, Doctor. Commissioner Pennington, any questions for the doctor?
Yeah, just Dr. Oda, would you have any idea who might be able to give us information as to when, based on the number of ICU beds or the percentage of ICU beds occupied, when we should have the yellow, red situation?
Yeah.
Are there any resources for that?
Well, I think I would have to probably consult with my colleague, Dr. Era Feinstein at Banner University. As you may know, he's a trauma surgeon there, and he does handle, he does round in the surgical ICU. And so he would be able to make commentary on that specifically. And I know he, from time to time, is a part of our events. So.
Commissioners, that might be something also for either Rick or Jessica from AZDHS. I'm not sure if they are able to also provide any insight. They are the ones that their agency repository for the data.
Yes, please. Thank you both for joining us. Would you please chime in and give us your thoughts?
Yeah, sure. Hi, I'm Jessica. I'm an assistant director here at the department. You know, it's interesting when you look at that data, and I don't have a clear-cut kind of green, yellow, red for you all to consider, but I do think it's worth considering what the hospital capacity is when you're thinking about holding your events. We have heard from the hospitals during a typical influenza season that they're running at about 90% capacity. So it's not unusual for our hospitals to be full like we're seeing now, but care for COVID patients is a little bit more intensive, and so there's some staffing ratios to consider too. And what we have on our website is truly just the amount of beds that are occupied. So I think it's a little bit hard in the context of COVID to really set a specific threshold. In addition, hospitals have been adding surge beds that aren't typically licensed beds. And so sometimes those numbers are based on beds that aren't normally in the hospital too. And so again, that's another thing that makes it a little bit tough to make a clean call on when you might consider stopping events. Part of it could be what you're seeing in your local region. So talking to the hospitals that you'd most likely be making transfers to in the region where you're holding your event and getting an understanding of what their local capacity is there, particularly dependent on the kinds of injuries that are being treated from your athletes, is another opportunity that you could pursue to get a sense from those local facilities about what's going on there.
And so, commissioners, if I may, real quick, you know, we're talking about, you know, the hospitalizations of athletes. So I had Carlo pull just some loose data for some of our events. Last year, in 2018, April 2018, we had a major MMA event. There were 14 bouts, so 28 athletes. Of that, there were 17 that resulted in a medical suspension longer than 30 days. That's 61% of the athletes involved in a major MMA promotion were medically suspended longer than 30 days. Now, that could just be, you know, 45 days is a cut, so that could be a simple cut, not needing to go to the ER. But there were 6 that were suspended for 180 days. 180 days typically are neuro suspensions, anything to do with brain, that we suspect a brain injury or a break or more significant. So, you know, it's something else to consider that although we are, the sport has evolved and we've taken measures to become safe. Once again, it's just an inherent risk in these sports. We've had the same promotion have an event the following year, and the suspensions were way down. It depends. You don't know how the event is going to go, and we have to consider and plan for the worst case scenario.
Sure. There's always the chance that any event we put on will put some stress on the system. Commissioner, please.
Yeah, Mr. Chairman, might I just share some of my concern? If we have a promoter, let's say we've got all of this COVID protocol worked out, we've got an event being scheduled, the promoter has provided us with all of their information, we've gone through all the testing, et cetera, et cetera, et cetera, and now we're 3 days away from the event and the hospitals are full. You know, that's just gonna stop the whole promotion at that point. It's a very difficult situation, especially if we're having to check with the and I'm not faulting ADHS for this. Clearly, this is a really confusing situation. But if we're having to consult with the local hospitals a day or two ahead of an event, and then we have to cancel the event because the hospital beds are full, the promoters hung out there. They've expended a hell of a lot of money and have no idea that they can do it until the very last minute.
Yeah, Mr. Penny, you bring up a good point, and that's kind of also happened with just the events in general. One of the first UFC events, one of the athletes that traveled to Florida, either him or somebody in his camp tested positive for COVID-19. That canceled the entire bout. So that's two fights that are, one fight that's off. The more people train together and expose each other, there's potential. And this is one of the reasons that protocol talks about we're encouraging athletes not to share corners, is because then we can have a potential, of having multiple bouts canceled because of positive tests that we're learning about, a day or two before.
Right. I mean, it's one thing for UFC to have to cancel one or two fights or even redo a whole event. But our local promoters, it is very, very difficult on them. I mean, it's difficult on the UFC and other big-time promoters, but our local promoters, it is extremely difficult. They just don't have the depth of resources, unless I'm mistaken.
Yeah, I believe that's something Mr. Lopez from Rough MMA, I know he's here and he's going to speak when we get to Rough at the next bullet point on our agenda. That might be a question that you can, get his input. He is, wanting to do an event at the end of this month, and him and I've had these kind of conversations, and he's expressed his, same concern. And so he might be able to be the best one to give you his feedback on how he feels that would impact his promotion and his event.
Certainly.
Thank you, Mr. Meneses. I do have one question. In a generic event that's going to be televised, because there aren't going to be obviously guests in the seats, how many people are in that room, ballpark, between fighters, commission personnel, TV personnel? How many people do we need to confirm have been tested and are negative, ballpark?
Rough estimate 75 is the minimum. 15 from the commission is critical. Yeah, critical staffing for commission would be 15. That's at bare minimum. Numbers I really don't even truly like to do for staffing for the events. Sure. But trying to keep it low would be 15. Plus, looking at the numbers that Mr. Lopez recently submitted for what he estimated for production stuff, 50, high 50s-ish. So we're ballparking around 70 for a local event. When we were in talks several weeks ago with the UFC, we were talking roughly close to 100 with the additional camera and commentators and so forth. So it's still going to be under 100, but I know we're also back to a different situation where we're also trying to limit how many people are in a room again because of the case surges. So it's all stuff that we just got to still consider, I guess.
Thank you. And who does the expense fall on? The promoter to test 100 people?
Yeah. So as of right now, this is one of the things that I noticed as a flaw within our own developed protocol, and this is something that we would need legal to definitely review and give us an opinion on. We did develop it, and the wording does say that the promoter is financially responsible for the testing, shipping, collection, all of that results. I don't know that the commission should or does have the authority to dictate who pays for the testing. I think our authority would be limited at requiring the test. No different than any other medical test. We require physicals and eyes and blood work, but we do not require the promotion to be responsible for those costs. So that would definitely be something that I recently, just re-reviewing through the protocols that we developed, caught my eye that I would want to have legal definitely delve into.
Thank you. Commissioners, doctors, any other thoughts?
One thing that I was thinking was that, and I know we kind of do this already, but Francisco, for every fight, puts a list of the nearby hospitals together for triaging when fighters get injured. And not sure how much more work this would create, but if rather than, given the nature of our current problem, rather than focusing on just who the nearby hospital is for transfer, maybe it's something that we create kind of multiple, quote, insurance policies with various hospitals for the event that it's like, hey, for every, injured fighter that we get, maybe we would spread out the burden, if you will. So, for example, hospital 1 would get the first one, hospital 2 would get the next, hospital 3 would get and then it would just kind of, and perhaps that way it would be less of a, maybe a little bit less of a worry that one hospital might be saturated. That could end the whole event.
Hey, Doc. Yeah, so I think we can do something very easy like that and kind of just modify what we're already doing. Right now, we notify the nearest Trauma 1 center, and that's usually the information that we provide on the to our commission staff is the nearest Trauma 1 center. Maybe we develop a little bit bigger of a list and put the other trauma centers, the 2s and the 3s, and as the ringside physician, you would need to determine which facility you're recommending the person go to. Obviously, if someone you're having to do follow-up on a cut, you could recommend them go to a level 3. But if we're having someone for a concern of a head trauma, you would direct them to the level 1. We would still continue to notify the level 1 in advance of the event so they know that we have an event going on and they potentially could see those cases. But I think that's something that we can easily just modify from what we're already doing. And AZDHS has on their website a list of all the trauma centers we could easily pull off.
Okay, great thought, Doctor. Well, let's keep talking about it. How about that? Every meeting, I hope this doesn't go on for an extended period of time, but I won't be surprised either. Thank you all for chiming in. We're trying to build this beast as we move along and match it with the current situation, which keeps changing. And Dr. Oda, I'm so glad to hear you're feeling better.
Oh, yeah, thanks. Me too. It was, that was quite a nightmare.
Yes.
What were your symptoms? What were your conditions?
The symptoms?
Yeah, how were you affected?
Oh, yeah. Oh, man. Day one, you just feel like you're hit by a massive truck, and real high fever. I was up in like 104, and then just sweating, coughing, shaking, and all you want is to just knock out, but you can't go to sleep. And then actually the on day 3, I thought I was getting better, and then day 4 hit and it got even worse. It was like this, like an upswing, and then just crash. Didn't eat anything, didn't drink anything. It wasn't until actually just today that I don't actually need any medicine now. So that was a total of 11 days. Still kind of dizzy sitting up, but I can tell that I'm coming back together. Brain is still kind of foggy. So, but very thankful. This could have totally gone.
So it wasn't just respiratory. I mean, it affected your brain and a lot of other portions, or?
Yeah, I remember at night being very delirious, like almost like hallucinations.
Huh.
Yeah.
Well, sorry about taking time in the commission meeting, but I did want to find out. Thank you very much, and I'm sorry that you went through that.
Yeah, hopefully this means immunity, but I guess we don't really know yet.
Yeah, true that. Well, Dr. Oda, thank you. Direct, Jessica, thank you for your time and interest, and more to come. Shall we press on, Mr. Meneses?
Yeah, just if you don't have any questions for either Jessica or Rick or Dr. Oda, they're free to go. They can stay if they'd like, but if they're free to go, if they have something else to do, if you guys don't have any more questions.
I have no further questions.
Thank you, sir. Mr. Fletcher.
Okay. Thank you. Thank you for joining us. Really appreciate it.
Yeah, Rick, Jessica,
Let's
thank
jump
you,
into
Dr. Oda.
Yep.
Dr. Oda, Rick,
Thank you
Jessica,
for
thank you so
having us.
much. Appreciate your help.
Thank you.
Yes. Take care, all. Item 4 is rough MMA. First portion of which relates to operational plan. Mr. Meneses.
Yes, sir. Mr. Joel Lopez, the promoter from Rough MMA, is joining us. He is off mute. I'll just quickly go touch these 3 things, then I'll kind of, turn it over to you guys and Mr. Lopez. But Mr. Lopez has submitted his operational plan. I have given it a review and matched it up with our proposed COVID protocols. It appears at this time that he has addressed the 10-point plan and the concerns that we had. As for testing, I spoke to Mr. Lopez this week, and we had gotten confirmation from the testing company that he has partnered with. And he forwarded me the email saying that they are using a CLIA certified lab, and that they promise or can guarantee to have results right about the 48-hour mark and get those to us. So they're trying to guarantee that. And so we have the testing plan. It's one of the approved FDA tests. They're going to use the nasopharyngeal, if I said that right, Dr. Oda, nasal swab test, and it is a DNA test, essentially, right? And it comes back within about 48 hours to let you know if you have an active infection. So that is one of the best tests that are being used. My understanding right now is the nasal swab test, provided it is done by somebody who is familiar with its placement or where it needs to go. Mr. Lopez submitted his event request for July 31. Of course, we were hoping that the COVID protocol could be implemented and adopted today. So could his operational plan, so could his COVID testing plan, and then the commission could review and consider his event request for 7/31. Unfortunately, because of where we're at, it doesn't sound like we're at that opportunity, but I would like to try to hopefully have the commission work through any questions or anything they have now, so that we do progress forward and we put Mr. Lopez back on the agenda. We can just keep moving forward. Like I said before, we're just trying to knock down these hurdles and see what we got to do.
Thank you, Francisco. Mr. Lopez, thanks for joining us. You have always been really thorough when it comes to putting on events, and I think nothing's different about this. You put together a really thorough operational plan and testing plan, and I want to thank you for that.
Thank you, Mr. Chairman. Thank you very much.
Commissioner Pennington, do you want to speak to this situation?
As far as the operational plan and the testing?
Sure, please.
Yeah, I've reviewed those, and I agree with you. It seems, and Mr. Meneses, it seems as Mr. Lopez's operational plan and his COVID testing fully meets the draft of the protocol that we are trying to establish. And I want to commend him for the hard work that he's done on it. I would like, if he was on the phone whenever I was asking questions of Dr. Oda, how this might affect promoter, or actually just making comments regarding the full hospitals and how that might affect a promoter. I would just like to get Mr. Lopez's opinion, not opinion, but his whole background information on how this is affecting local promoters.
Mr. Lopez, will you speak to how all this affects your business and your ability to put on events?
Absolutely. Again, thank you everybody for being on the call. Commissioner, Executive Director, Chairman, Dr. Ken Oda, it's good to see that you're on the men's as well. When we heard about this whole COVID pandemic, we were at we're at a crossroads whether or not to continue doing this business, given the situation and how it's evolved. And right now, with my team members and my partners, we decided, re-examine the whole MMA entertainment industry for our purposes. So we have to adjust our sails and figure out what we're going to do as a promoter. Now, we're in the business of entertaining people. We're in the business of event organization. We're not a regulatory business. So, our main focus is to entertain people and put on great fights and ensure that everybody's doing what they're supposed to do in order to have a great event. Now, given the situation right now with no spectators, it's putting us in a situation where we can't draw any income. So thinking about how we're going to go about doing this is figuring out how to capitalize on a pay-per-view stream. So we've managed to partner up with a company who's going to do that for us. Without no spectators, that falls in line with the CDC guidelines and the guidelines of the state as well. And I think we kind of figured out from a local standpoint how to do this. Now, the numbers that bigger promoters are going to get, but I think collectively, I think we can accomplish a lot. Given our situation, our unique situation, we have an actual studio. It's a movie studio that's perfect for a closed circuit event or a closed to the public event with no spectators. So I think we're in a unique situation right now, but it's, with all the regulations, I think it's going to impact us a lot. I concur with you, Commissioner Pennington, about the hospitals. What if the hospitals are at cap, during fight week or the week of or the day of? That's concerning to me. I hadn't thought about that until today. Closing and canceling the event would put us in a bind, would put us not only in a financial stressful situation, but it also a reputation with the fighting community and the gyms would be hurt. It would definitely hurt us, and allowing us to build upon those relationships in the future. It would be hard to get those fighters back or those coaches to commit to these kind of events. So it's not only going to hurt us financially, but also from a perceptional standpoint, it would definitely hurt us. And we can't afford to do that right now since we're just a local promoter. So considering all things, Francisco's done a great job communicating with us, asking us of everything. I believe we've done our best to comply with everything. And at this point, we just want to make sure that we do the best thing for everybody, for the fighters, for the community, and also stay within the law. And so whatever decision is given to us, like I said, we'll roll with the punches. We'll adjust our sails to whatever we need to do to have a safe, successful event, whether it's now or in the future, or wherever the commission sees fit.
Commissioner, if I can just
Thank you.
just add real quick.
Please.
Mr. Lopez and Rough MMA, I mean, they were a little bit ahead of this. Prior to one of their last events, I got to tour their new facility, and they were already looking for the future before COVID hit. They were already looking at how they could do these events in a studio, which they now have. They have a green screen room. One of the last events we did weigh-ins in this space, and they had a camera crew there televising the weigh-in. So they were already in the works for doing this. Going back to what I said earlier, I'm gonna keep saying it. I guess it's my new catchphrase. Is just another hurdle. And they've shown that they can keep knocking these hurdles down with us. So we're just gonna all keep punching forward. We had one with the operational, and I happen to have an operational plan. They got it punched out. We had a question about testing. They got it knocked out. So it's just one thing after another. Eventually, and Mr. Lopez and I had this conversation prior to the meeting today. Eventually, the sports are going to resume here. We know it. We know there's a fan base here. We know there's a lot of talented athletes in this state. We have great officials, world-class officials that travel all over the world and help regulate. And so it's not a matter of if the sports are going to resume. It's just a matter of when. And I'm confident we can do that. One thing we have to just keep in mind, and we talked about this earlier, is with the gyms. I have, preliminary rumors that I'm hearing right now. I don't know if it's confirmed, but there's a small outbreak at one of the MMA gyms. Multiple athletes have been exposed or tested positive. I'm also hearing unconfirmed rumors that some of those athletes that have tested positive, they're not showing symptoms, are still in the gym training. So that, if that is true, that's also very concerning, because and this was something that we talked about one of our commission meetings when COVID kind of hit. One of my concerns was that the fight community, these sports, with so many people training in confined spaces and gyms, that this really could spread like wildfire through a small group of individuals. And so if these rumors are true, where people are starting to show positive at some of these gyms and still going to the gym, if that part's true as well, this is just going to be very detrimental to when we can resume, because we're going to start affecting our local athletes here.
Thank you, Mr. Meneses. So, Francisco, do you have recommendations regarding Mr. Lopez's event request?
So as of right now, I would recommend the commission deny the event based on the COVID protocol not being formally adopted. It is not in the interest of the state, the industry, or the health and safety of anyone to move forward with an event without a strong foundation for the COVID protocol testing. With that said, I would recommend that we decline this event for now and push it for review for the next commission meeting as we continue to work forward. Right now, we have a tentative date for August 5th. That's a great goal to shoot for. I was talking to Mr. Lopez this morning, and I recommended to him that whenever we finally do get the COVID protocol adopted, that if he still wants to do his event, that he do it roughly 3 to 4 weeks post that meeting. That way we know all the hurdles are done, and then we're solely focused on his event and making that event be as successful as possible. And so it's just a matter of I guess, waiting. I do think his operational plan as of right now does meet what we've asked, but I don't think the commission can make a motion to adopt that, since we don't have a COVID protocol to say that it matches with the COVID testing plan. We don't have a COVID protocol to say that he's in line with that, so we can't rule on that. And third, because of the novel COVID protocol, we can't make a determination, or I'm sorry, we can't approve his event request. So my recommendation would be that we table all 3 of Rough MMA's matters on the agenda for a future meeting.
Okay. I was going to ask table or decline. We will, if you would please table all 3 for hopefully August 5th, and we can keep talking about this. Mr. Lopez, you always put on great events. You're a brave man for jumping into the fire on July 31st, but we're close. Once we get our protocols together, I think we can move forward once we sort out some of these other bits and pieces. But I look forward to doing an event with you guys here soon, knock on wood. I really appreciate you being open and malleable in the face of all this, too.
Thank you, Mr. Chairman. We look forward to it.
Thank you. Mr. Meneses, let's table these 3 pieces for August 5th and reconvene at that point.
Sure. Kelly, we don't need a motion, right? We're good with that?
Probably should be a motion.
Okay.
Mr. Chairman, I move we table items 4, 1, 2, 3 until the August 5th commission meeting, or the next commission meeting, whether that be August 5th or some other date.
I will second that motion. We have a motion and a second. All those in favor signify by saying aye.
Aye.
Aye. Motion carries 2-0. Mr. Lopez, thank you so much. Really appreciate your time with us. Item C is our call to the commission. Commission members or the executive director may introduce a summary of current events, ask questions, and or make comments. Mr. Meneses, you have anything for us?
Nothing additional. I think we've covered a pretty broad spectrum of the summary of current events for the commission in the last hour, so I think we're good.
Okay, thank you. Commissioner Pennington?
Mr. Chairman, the only thing I want to do is thank all of the participants today. My count showed that we had about 25 that were 21 to 25 that were non-commissioned staff or commissioners. And I really want to thank them for their participation today.
Yes, agreed.
And I have nothing further.
I'd love for us, as we have meetings going forward, to find a way to get people in, if I can ever figure out how to work Zoom. But that's my problem, not yours. But it is great to have everybody involved in our meetings, because they can be lightly attended at times. So thank you all for taking the time and being party to this, which leads us into D, call to the public. If any of you would like to chat with us, we'd ask that you keep your thoughts to 5 minutes. Mr. Meneses, anyone like to chat with us?
So just as a reminder, I'm going to just read this off. If you're attending via video conference and you would like to address the commission, if you go to the bottom of your screen, there's a participants button. If you click on that, a list of all the participants will appear. Next to your name, it'll say raise hand. You can click that button. It'll show that your hand is raised by filling up a little blue hand. That'll let Carlo know, and he will unmute you, and you can address the commission for 5 minutes. We'll give a few seconds to see if anyone has their hand raised. Carlo?
We have Sean Dallas Hall ready.
Sure, go ahead, sir.
Yeah, I have a question in regards to one protocol in particular, the 72-hour pre-event testing. Is there anything that can be put in place to kind of maybe curb an issue of that 72-hour window being that somebody would go and cut weight? I mean, they're cutting weight at that time. They would go and cut weight at a gym or with other people, and in the process of that, catch or contract COVID and not be in a environment that is free of COVID. I mean, is there something that can be put in place into there, or can anybody speak some more on that, I guess, maybe, and kind of clarify?
Yeah, so yes and no. With more enhanced testing, obviously, that puts on a further responsibility on the promoters. Ideally, if we could test someone every single day, we would know exactly who they've been exposed to and along what process or which way they've picked up the virus. For these local promoters, we're already asking to test somebody before they leave their state, and then also everyone in state. So that's already putting a pretty big burden there on them. That's why part of the COVID protocols recommend that as much as possible, we just encourage everyone to isolate as much as possible with other people that have been negative or have been tested. For larger promotions, that's much easier because they're able to just shove everybody into one hotel and cordon off that hotel, and that's good. So we thought about that. It's really not, I guess, fair to put that onto local promoters that they have to isolate everybody at a hotel, as well as, at what point does everyone have to be tested? You test them every single day or what? So that's why the fallback is also us doing follow-up 14 days post-event. So the promoter will follow up with all athletes and promotion staff within 14 days just to see if any new symptoms have developed and to keep the commission apprised of that, as well as the commission will follow up with all officials within 14 days and determine if anyone has started to develop symptoms. That's really the extent of what we can, I guess, do now, unless more testing becomes available at a lower cost to where it's more accessible for promoters to put out multiple tests. Dr. Oda, do you have something different or anything to add? No? Okay.
Thank you, Mr. Hall. Testing's an issue. I mean, an instant test would be a lovely thing, but it doesn't exist. So
one thing I'll add, if I may.
Mm-hmm.
So right now, at least my understanding is the rapid testing that exists. There are a few companies that have been given emergency authorization by the FDA. What I've been reading anyway in the peer-reviewed journals are that the specificity of these rapid tests are pretty high. However, their sensitivity is pretty low. From a biostatistic standpoint, for our purposes for what we are doing with a sporting event. Unfortunately, that would not be the way to go if that ever does come up, just because the sensitivity somehow improves, because what will happen is it will miss people that are positive. The chances of it missing people that are positive are high. And then what would you have to do is, if you had a negative in somebody who thought that, I'm sorry, I'm getting a Skype call at the same time. I'm not really sure what to do. Anyway, you would end up having to swab them if it were negative as your confirmation. So that's my only commentary on the rapid testing.
Okay, thank you, Doctor. We enjoyed the background music too.
We have someone else.
Who is it, Carlo?
AJ, can you please say your full name?
CJ Pittman.
Go ahead, CJ.
Hey guys, thanks again, and Dr. Oda, I'm glad you're feeling better. Just a few questions, like on the operational side of things, or things to look into in the future as we go forward. So I guess one of my thoughts is like, you've been to our studio, you've seen our facility, it's 80,000 square feet. There's 27 something rooms in there. Can we look at the possibility of a closed facility once, just like a lab would be almost? Everybody that's allowed on property has already passed a COVID test and already been deemed negative. So then now you're in a sterile environment type of thing. Does that make sense?
Sure. So that's kind of the plan for the COVID test, or for the protocols, is to ensure that everyone that's going to be in the venue is tested within a few days or few hours of the event, to ensure that we mitigate any exposure. Once again, in a perfect world where we could have a hotel or a lodging facility attached to a facility, we could isolate 100% everybody in there and try to keep them as close as possible. But even talking with the officials in Florida, in which they had a isolated hotel for a UFC event. I was informed by one of the doctors that they could look outside of their hotel window and see groups of fighters creeping across the street to go get takeout or something without wearing a mask or anything else, possibly exposing themselves to who. So it comes down to also personal responsibility. We can only police it so much, man. It's really difficult in this day and age with this virus, and people wanting independence. It's just really difficult for us to try to police that. The best we can do is to try to require a test before the event, and try to encourage people to isolate the time between.
So looking at how an event like that may happen on a property, like we've done in the past, Blue Water or Twin Arrows, where everything's self-contained, is there a way we can discuss that in the future? As far as, I know they're not going to shut the whole casino property down, but at the same time, we can limit their access and their access and exposure to public or any other contaminating source, where food is on site, you're out in the middle of nowhere, there's nowhere to walk to. Where are you going to go from Twin Arrows?
Sure. But even in that situation, we have to consider that, like a Twin Arrows or Blue Water, you have other guests that aren't there for the event that are going to have exposure, and we don't know what they have. You have employees, you have, public employees that are coming in and out. We just don't know. It's great. We're definitely narrowing down the possible exposure, people having opportunities to leave, and we are, for contact tracing purposes, limiting who we know would possibly be causing that or where they got the virus from. But once again, now you're in a smaller space and everyone's constantly seeing each other exchanging. It could also cause the virus to go much further. But yeah, it's all CJ. It's all part of stuff that it's all working document because of it's so fluid. I think when we're ready to start discussing, once we're actually able to adopt the protocol and move forward, then we can start discussing when we move to other venues how we're going to handle that. Because I think this, just like we're seeing with test results taking longer than the anticipated 24 to 48, we're going to have to go back into the drawing board and revisit where we're at that time. And that's going to be the same thing when we look at a new venue that we're going to up north or out west. What precautions do we need to modify in our current COVID protocol to fit that situation?
And I completely agree with that. I'm just looking as far as to make sure that our efforts as far as the event organization are being best put towards what they should be, and I'm not off trying to figure out something else. That I know kind of, where you guys stand on that part. Because I hadn't been in a lot of the communications between you and Joel, and that's not my role. But when it comes to what are our possibilities and what are our potential venues and things like that, as the future progresses. So no, I definitely appreciate you guys addressing that, and I think that's it for my questions or comments.
Thanks.
Thank you. Thanks, CJ. Appreciate it. We'll do everything we can to keep the public and the promoters apprised of where we're headed with this too. It's best that we all keep talking so we head in the same direction too. But thank you. Francisco, anyone else want to chat?
Carlo?
Nope.
Okay. Well, thank you all for your time. It's been, I think, a really good session. I think we're headed in the right direction. And we will have more to talk about, it looks like, on August the 5th, which is an announcement I have for you. The next regularly scheduled commission meeting will be at 10 a.m. on Wednesday, August the 5th, 2020 at 1110 West Washington Street, Phoenix, Arizona, 85007, and is subject to change based on a quorum. Item F is adjournment, assuming there is a motion for such.
Mr. Chairman, I move we adjourn.
I will second that motion. We have a motion and a second. All those in favor signify by saying aye.
Aye.
Aye. Motion carries 2-0. We are officially adjourned. Again, thank you all for your time. We will live to